Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. In this video, let's take a look at how you can manage and heal pityriasis with natural and effective therapeutic tools. Pityriasis is a common skin condition and usually affects more children, adolescents, as also the middle adult age group. Pityriasis comes in different types and therefore also different causes. Maybe it's viral or fungal proliferation, maybe it's related to other skin disorders or deficiencies, as well as environmental toxicity. And therefore the treatment is decided by looking at the overall picture, the overall condition, as well as the history of the patient. It also can be confused with other skin disorders, maybe like psoriasis because of the scaliness, vitiligo even, because pityriasis also has these white little spots like vitiligo, and even leprosy. So enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs ups and likes as they help me grow in my channel. And lastly, have a look at my website, medicanova.net, at the online academy, where you will find comprehensive certified home study online courses in homeopathy, in mental health, and health and wellness coaching, quantum healing, and so much more. So what is pityriasis? Well, it's a skin disease characterized by the shedding of the fine, flaky scales from the surface. The condition can occur due to various causes, which I mentioned before, but it holds also this cosmetic seriousness because it affects the individual's quality of life, particularly if it's in the face. Most commonly affected are children and young adults, and the skin condition can be classified, therefore, in various types depending on the causes, the predisposing factors, the associated factors, and many other different reasons. So it becomes quite a complex picture. So let's look at the different types. Pityriasis versicolor, alba, rosea, as well as Pityriasis rubipilaria, as well as lichenoid chronica, and lichenoid varioliformis acuta. Let's talk about the common ones first, so you get an idea. And also we'll put up some pictures because each type looks a little bit different. So Pityriasis versicolor, also known as Tinea versicolor, is a frequent benign. It's superficial fungal infection caused by a kind of yeast. And it's called Rosacea furfur. It's kind of an elegant name, furfur. It reminds me of fur, basically, something like. But clinically, it is identified by these hypopigmented and finely scaled macules. Often appears in the upper trunk, which later can spread to the neck and the upper arms. Definitely comes out more in humid climates or warm. Often they disappear during the winter times. So what are the symptoms? Well, you have these discolored patches of the skin. They're most noticeable, really. And they may be even lighter or darker than the surrounding skin. They can be dry, often quite itchy. And the patches are, however, prominent with tanning, because it's darker skin colors, it's more prominent, but disappear often in cold climates. What are the risk factors? I would say genetic predisposition, environmental conditions. I mentioned anything what's more humid or, it's more, probably comes up more in Hawaii or Florida, it becomes quite humid. Malnutrition, there is definitely diet-related issue involved here. Pregnancy, hormonal changes. Also, if there's an excessive use in oral contraceptive pills, and diabetes, I would say, come in here as well. So what is the diagnosis? Well, really, it's more this clinical presentation of the lesions, and it's confirmed It's called by a wood lamp examination. And then the scaly lesions may look pale or yellow or golden or yellow or coppery orange fluorescent. So it has a certain sort of display for it. The Pityriasis alba, the name alba means white. And I mentioned it can be even confused a little bit with vitiligo. But the idea is that there are fine scale in alba, sort of pale colored patches. It's characterized by these ill-defined macules and patches, maybe thin plaques even. They're round or oval in shape, often with mild scaling, and sometimes there can be, we call it pruritus. Mild pruritus means itching involved. And they're most commonly located in the face, and that's why it makes it so difficult. I put a picture up here as well for you, and especially the cheeks. So you have these skin colors, and then you have this sort of whitish patches on the face. They can be on the arms as well as in the upper trunk, and they are more noticeable in people, of course, with darker skin types. You see it more in children between the ages 11 and 16, but 90% usually occur below the age 12. Pityriasis alba is not seasonal, and although scaling may be worse in the winter, maybe because of a result of dry air in the homes, and the lesion may be more obvious in the spring and the summer. Why? Because of the exposure to sun, right, and the darkening of the surrounding skin, because these less pigmented white spots, they don't get dark. And so, but usually, you know, these skin eruptions, they can disappear within a year as well. Now, research doesn't know why this is happening. It's not contagious, which is good news here. And there's no infectious etiology involved here as well. It just looks, you know, unsightly basically. Rosea, Pityriasis rosea, you can see already from the name rosea. Here we talk about more pinkish colored sort of papules and macules. And the site of the lesion again is on the trunk. But it also can happen on the back. And then it looks, if it covers the whole back, it looks like a Christmas tree. And I put a picture up here as well. So it's like the spine becomes over the stem of the tree, and then the branches start to sort of radiate from that. Again, the etiology or the cause is unknown. And factors here like seasonal variation suggest that it can be related to an infectious disease caused by a virus. It's called HHV7 more frequently. And there can be an implication here, so check that out as well. But it's more common in the winter season here. So what are the symptoms? Well, often the eruptions are the first indication that there's something off here with you, and then it goes into the sore throat. There can be gastric disturbances, maybe fever, and even stiffness of joints. But the main symptoms is the appearance of this herald patch, which is located on the neck or the proximal extremities, and is seen usually in 90% of the cases. Again, we have a little itchiness with it as well. And then we have rubra pilaris. Again, it's more inflammatory here. I mean, they all look a little bit the same. Some is more whitish, the other one is more pinkish, and here it's more pink to orange. And I think here more the inheritance, the genetic factors is more predominant here. And again, it can be seen in children, but here also in adults between 40 to 60 years. Often the trunk is affected, but you see also this yellow-orange thickening of the palms and the soles. That gives it away as well as the nail plates that can be happening here as well. With it comes malaise, comes fever, maybe a chilliness. So look out for that. But then we talk about more viral situation as well. With the Pityriasis lichenoid chronica, again, it's sort of like it's a slow developing situation. The onset of the papules is more gradual. And initially here they appear pink and scaly, but gradually flatten and become brown in color over periods of weeks. So it changes its outlook. Again, the etiology and the causes is unknown here. And in some cases, people with Pityriasis lichenoid chronica have had maybe infections prior, particular Epstein-Barr virus, and therefore there's the relationship to autoimmune disease, toxoplasmosis, and maybe HIV even. So again, here you have to have a skin biopsy to make sure that you got the right diagnosis. And then we have pleva, which is Pityriasis lichenoid et varioliformis acuta, but I don't want to go into this at this moment because I want to keep it simple and accessible for you. If you're interested in a health consultation, either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. Today I want to leave out the section of the food for thought, the metaphysical meaning behind it, because I just want to give you really the ins and outs how to meet the situation. Not just always talk about, what's the story behind it, but just as a hint, always go within, check in with you. Is there anything what's really interfering right now in your life? What causes you anxiety? What causes you to have something itchy in your life, right? Who causes you to feel, scratched, or what bothers you, or what's under your skin, which you want to get out. Whatever it is, I wish you all the best, and be courageous and explore a little bit what could be the mental and emotional trigger here, so your body produces and uses this as an expression for you to wake up. So what are the natural treatments? Well, first of all, because we talk about pruritus, we talk about itchiness, so I would bring an oatmeal bath. And in general, it's best to use more lukewarm water here rather than hot water, because that could aggravate the itchiness again. And you want to maybe take 1 cup of ground oatmeal to the bath and soak in there maybe for 15 and 20 minutes. Some find it a bit messy, so I suggest you get maybe a washcloth or a stocking, put the oatmeal in there, really make sure you tie it really well at the top so it doesn't leak out in the water, and then enjoy your soothing oatmeal bath. Externally, you want to maybe bring in aloe vera application. Gel is here wonderful. It really cools down the skin. It also moisturizes it, helps to keep the skin hydrated, promotes healing, and discourages the itching. One of the best, most highly acclaimed natural skin relievers is definitely aloe vera gel. And in addition to being an amazing moisturizer, it's also anti-inflammatory and soothes the skin. Aloe vera has been shown also to contain lots of antiviral properties next to vitamins and minerals and antioxidants, fatty acids, just all you need to boost your skin health. On the other hand, some find that aloe vera gel can sometimes dry out the skin, so I would also bring in coconut oil. It's a wonderful moisturizer, and it contains beneficial fatty acids, and making it a great natural choice that will help to discourage further inflammatory conditions, dryness, and itchiness. Even though it's not 100% clear what causes Pityriasis rosea, for example, there's research to support viral roots in the skin disease, and coconuts are known to possess potent antiviral as well as antibacterial and antifungal agents, and that's wonderful. In general, I would say with pityriasis, stay cool, right? 50% of the cases are often brought up more by excess exercise or sweating or hot showers. So what can I say? Be patient. It will go away. As I said, it's not contagious. But you want to find out the causes of pityriasis, right? It's not just a situation where you slap on the hydrocortisone cream or even some steroids or take some medication. Look at what the overall condition is. Did you had mononucleosis or glandular fever with Epstein-Barr virus in your past? Were there other skin conditions involved? Is there maybe a food ailment trigger involved? Sometimes fruits, a person who eats a lot of fruits can cause pityriasis, right? So you have to dig a little bit here. Now, according to the National Organization for Rare Diseases, the rash is usually located again on the back, the chest, the stomach, and resolve on its own within 1 to 3 months. So what is the general management of it? Well, you have to educate yourself. You have to get a little bit into, go to Google or read a little bit about it. It is benign. It's not something too difficult, but it has different aspects to it. And treatment in general consists of very good general skin care. Take care of yourself. Make sure you are protected from sun exposure because it darkens the skin around the white spots. Sunscreen may help here. Mild emollients, I talked about coconut oil. And patients should be also informed that the causative agent of pityriasis is usually a fungal agent, or the skin flora is affected and therefore it's not really contagious. It can be dealt with. Recurrence rate is common and therefore you want to bring in a prophylactic therapy treatment as well here. In this case, homeopathic remedies, which I'm sharing with you in a minute. And good personal hygiene, I think, would be wonderful. So, if you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I'm coaching you to be well. So let's talk about homeopathic remedies. I think they're fantastic here because they not only deal with the acute situation, but also address the preventative aspect, which we want, because we don't want pityriasis every 3 months. But here you would need a professional homeopath. As you can see, pityriasis is quite a complex situation. It can have different causes. It can have, different aspects. Maybe the viral, the fungal proliferation is addressed here. So you need somebody who gets the overall picture and then is able to find the most indicated remedy. If you need more guidelines, contact my practice Medica Nova at health@medicanova.net or your local homeopath. So the first remedy is called Arsenicum alba. It's really nice. It's indicated for acne, rosacea as well, because pityriasis, rosea can resemble that, psoriasis, even ringworm. And the skin will appear quite dry, as parchment almost, with a cold and bluish, sometimes yellowish tinge to the skin. Symptoms can be a bit more shooting pains, hot itching, but also this violent burning in the skin. Miliary eruptions, red and white, chiefly in the head, on the face and the neck. But here the causation could be also related to diet or lifestyle changes. Like if somebody eats a lot of fruits, that maybe is a cause here to develop pityriasis. Ailments may be resulting from sea bathing or sea traveling. The skin symptoms usually are worse in the night and have these fish scales also involved, worse from cold and scratching, and better actually for warm application. Now, when the skin symptoms sort of like resembles more ringworm, I bring in an intermittent remedy called basilinum. And here you need a homeopath, but it's often indicated for Pityriasis versicolor. It's on the body and responds very well to this remedy. It's an intercurrent remedy. As I said, I sort of bring it in and then repeat the maybe first given remedy again after a while. And it's really great if you have this eczematous condition on the margin of the eyelids. It's a strong indication for that, with the aggravation at night or early morning or in cold air. You also can see maybe an enlargement of the glands around the neck here. That's another giveaway. So basilinum 200. Another remedy is carbolic acid. Beautiful and powerful antiseptic here. Again, indicated for Pityriasis versicolor. Basically, it means like different kinds of colors. It's like you have the paint color box here of different kinds of shades of Pityriasis. You have to take this with a grain of fun here as well. Disease doesn't have to be always heavy and in despair. But the skin is inflamed, and other symptoms maybe appear with burning pain, tingling, itching, and numbness. And there's a putrid discharge also involved, which means it's not a dry skin. It has maybe some stuff coming out. Meserum, another remedy indicated again for Pityriasis capititis and Pityriasis versicolor. We have large, irregular, sometimes confluent, distinctly sort of now coppered colored spots on the skin, right? So it changes now. Can be very distressing, burning, itching. And another giveaway is that usually worse around the menstrual period among the women, at which time the spots usually become darker in color, especially around the edges. Also worse from the heat of the bed, itching on the scalp, and so on. There can be also some ulceration involved. Another remedy is Phytolacca decandra, and here we have scarlet eruptions all over the body. It means deep, deep red. The skin is cool, shriveled, and bit lead colored as well. Again, the same thing. Itchiness, worse from heat, prevents sleep. So usually around the hands and the feet, and spreads all over the body. So we have to look. You can look at the discoloration. You can look at the color to decide which type of Pityriasis this falls into. Often Cantharis 30 is the remedy indicated among children. And here you also maybe see some bladder infections. If the child goes to the bathroom and then on urination there's maybe some burning pain, that could be related to it, and it will heal the bladder infection as well as the Pityriasis at the same time. But often this Pityriasis is worse from exposure of the rays of the sun. That gives it away for this remedy Cantharis, because it's also indicated for burns. So if you burn yourself on a hot stove, for example, and you have whatever, first, second, and third degree burn, that would be a great remedy as well. So clinical, it's called eczema solaris, which is caused, the Pityriasis is worse from exposure to sun rays. The eruptions are sort of mealy scales, brown-like scales. There can be this burning and this pricking sensation, which is quite marked, and it's relieved by cold application. So think about Cantharis. I want to give just a few more remedies. One is called Graphites, and that's a great remedy for Pityriasis capitis. Dryness of the skin, but here the skin cracks, and often we have sort of a discharge of a honey sticky fluid. Abundant desquamation means the skin just exfoliates, particularly on the hair and the scalp. The skin is rough and hard, and with obstinate dryness of the skin. And again, there can be absence of perspiration as well, but usually there's this secretion of this honey sort of sticky liquid coming out. And Graphites, when you go to the health food store, you get a number behind the name. And in this case, often it's 6 or 30. That's the potency, that's the strength. So you want to, I would choose the potency 30. Graphites 30 in this case. Maybe you take it 1 tablet for adults 3 times a day, for 10 days and see how it goes. Whereas with children, depending on their age, I would do it maybe just once a day and, leave it for 10 days and see how that goes. But as I said, you need a homeopath here. Another remedy I really like here is called Sepia officinalis 30. And the skin here becomes quite yellow, almost jaundice-like. And there's excess sensibility of the skin, And the soreness of the skin and humid places often are in the bends of the joints. So you have the inner side of the elbows, behind the knees. There the eruptions appear more. It's also indicated for these hepatic spots. So they're circular in size and they're quite brownish and reddish. I had great result with sepia when you see that at the margin of the hairline. I put a picture up here as well. Fantastic remedy for that. Really knocks it out immediately. And I want to finish with one common remedy. It's called sulphur 30. It's indicated for pityriasis on the head as well as on the chest. Skin is quite dry, scaly, unhealthy. But here also every little injury separates, so it oozes out something. It also is a great remedy when you have taken too many medication or too many cortisoids cream and it gets worse or it doesn't go anywhere. Sulphur is a good remedy to meet that suppressive aspect here. Usually there's desquamation, means the skin exfoliates in several places of the body. Lots of itching, definitely worse for warm or hot shower or excess exercise. Oh my God, the skin gets definitely more itchy here. Often worse more in the springtime in damp weather, and it can be worse, as I said, from the hot shower and washing. Homeopathy, of course, offers many more remedies for pityriasis. We have manganum, aceticum, berberis, colchicum, natrum arsenicum, thuja, and many other remedies. But for this purpose of this video, I want to keep it short, simple, and accessible. So I hope that the video has given you some insights and some inspiration to seek out more natural solutions. Believe it or not, there's always a way out. If the first solution doesn't work, go for the next one, right? Today we have access to so many wonderful treatment protocols, and pityriasis can be healed. There's no doubt about it. But if you have more questions you're not quite sure about, or you want to book an appointment, please contact my practice, Medica Nova, at health@medicanova.net. You can also contact me via my website, medicanova.net, and don't forget to have a look at my online academy, where you will find comprehensive, university standard, certified home study online courses. There can be from 8 weeks to 16 weeks. We cover homeopathy for the whole family and beyond, or homeopathy applied during pregnancy, birth, and postnatal care. Or you wanted to know about health and wellness coaching or integrated mental health. How about Alzheimer's, depression, anxiety? What can I do about that? And of course, quantum healing, which is based on my book, The Dance of Your Core Healing, Transforming Your Mind, Body and Soul in the New World. So till next time, much love, take care, and I look forward to see you in another video.